Title of my poster is The Effects of a Neuromuscular Program on Preventing Shoulder Injuries in Baseball Pitchers. Shoulder injuries are a huge problem for baseball pitchers as more than 50% of them experience some type of shoulder injury during a regular season. So understanding how we can reduce these or prevent them is going to be crucial to really prolonging a baseball career, as some of them can really be career ending. The purpose of the study was to examine if incorporating a neuromuscular program into the warm-up of a high school baseball team's pitchers would reduce the number of shoulder injuries seen during a regular season. The patients that we looked at were 6 males around the age of 16, and they all had about at least 6 years experience. So they completed a neuromuscular warm-up program at least twice a week before games, usually focusing on shoulder scapular stabilization exercises, rotator cuff strengthening. Here's examples of what they had to do. So first they had to do no monies, and they were all given a progression set of what to do each week. And then they had kneeling D2 pattern with a TheraBand. And then they did an exercise series called Blackburns and the T position, Y position, and arrow position. Some weeks they did these with weights, some weeks they did not. Lastly, they did a doorway stretch to finish up. To measure outcomes, they did a subjective outcome that was the Western Ontario Shoulder Instability Index, which has 4 subscales and it just records the function of daily living and how they feel during their sports activities. So this gives you a score from 0 to 2100, and the higher number is associated with higher shoulder dysfunction. And they did that at baseline and then again at 15 weeks. Same thing with the athlete's back scratch test. This was graded by if they were able to overlap their middle fingers. That was a positive value they were given from the distance. And then if it was not able to reach, then that was a negative value they were given. So that's how the athletes was scored. So here's the results for the Western Ontario Shoulder Index. From baseline to post-intervention, there was a statistically significant difference, but it wasn't enough to be clinical meaningful improvement. But it was still good that we saw a difference there. And then for the back scratch test, there was a slight improvement, but it wasn't enough to be significant. So for conclusion, the results showed improvements were made in both outcome measures, but only the shoulder index had a statistically significant change following the 15-week program. The clinical bottom line would be that the inclusion of a program like this does cause improvement in the function of their shoulder and minor improvements in shoulder range of motion. However, it would be better if you could incorporate this program more frequently, or if you could have more patients to participate, as we only had 6.